This Mental Health Week, the Canadian Mental Health Association is encouraging people all across Canada to see beyond the surface and to see the whole person, to unmask mental health.
Masking as an experience, it can be really exhausting and very wearing on a person's mental health. It can lead to isolation, disconnection, a loss of identity in some cases.
According to Lowe, masking is when we hide or suppress our emotions, personality traits, behaviors, or symptoms of illness out of fear of judgment. It's a coping mechanism that many fall into consciously or even unconsciously.
Mental illness and even mental health struggles and substance use disorders are so highly stigmatized even today. We know that people with mental illnesses and who struggle with addictions, they face discrimination.
Masking is an experience that Nick Petrella can identify with, having once struggled with feelings of shame surrounding his mental health, but has now found therapy in telling his story.
Regardless of who you are, where you grew up, types of parents you had, who you were raised by, there's always stigma around mental health and mental illness. And it's something that, because you can't see it, because it's not as easily diagnosed and it's diagnosed more by how you feel rather than what you see, there's a lot of stigma attached.
According to data from CMHA, about a quarter of Canadians surveyed for unmet needs for mental health care said they prefer to manage their problems on their own. And in another survey, 17% said they didn't want to talk to anyone about their problems.
The struggle is so behind the scenes. And if we could kind of reduce or remove the mask around the struggle that people have, maybe people would also be a little bit more empathetic and compassionate around what people are struggling with day to day.
The CMHA is calling on the federal government to write mental health care into federal law by including mental health and addiction as services part of Canada's universal health system.
We would want to see an expansion of the scope of providers. So, psychologists, counselors, social workers, for those agencies and providers to be able to provide those supports publicly. It would mean creating some sort of funding avenue to be able to make those services coverable.
Mental Health Week continues until May 11th. And for more information, you can head on over to cmha.ca. In Toronto, Rhianne Campbell, City News.